So today we're going to be talking about point of care testing, what point of care testing is, some benefits and disadvantages of using it in the pre-hospital care setting, and also different types of point of care testing. What is point of care testing? So it's also known as near patient testing. Point of care testing are any tests done at a patient's bedside at the time of consultation that give immediate results and allow healthcare providers to make immediate and informed decisions about that patient's route of care and disease processes that are being involved in that patient. So, like we mentioned before, point of care testing is done at the side of a patient or with the patient. So it could be done at home, at a healthcare practitioner's office, in the emergency department, infectious disease containment units, in ambulances, which is going to be the main focus of ours, at the scene of an accident, during combat in the military, on a radiology department, or even on a cruise ship. Who can perform point of care testing? So, most of the time, point of care testing is going to be done by healthcare professionals, such as laboratory professionals, emergency first responders, paramedics, stuff like that, radiologists, doctors, nurses, physician's assistants, other healthcare professionals. But sometimes, even if they are simple enough, non professionals can do point of care testing like home tests and different things like that. So, what's the point of care testing for EMS professionals? Laboratory results impact more than 70% of medical decisions when they are actually used. They allow for rapid critical decision making in regards to patient care. They can allow for early disease detection. Most point of care tests that we do in the field are going to be portable, so that's helpful, obviously. They allow paramedics to provide more information to physicians than they could do with vital signs and just physical exams. So that's helpful when transferring care over to the physicians. It has been shown to alter pre-hospital care in up to 30% of its uses. And clinical laboratory improvement amendments were put in place by the Congress in 1988 to ensure that those point of care tests and things used for point of care tests are standardized with quality control and accuracy and safety. So, what are the downsides to point of care testing in the pre hospital setting? Obviously, just like anything, there are going to be downsides, and it's probably one of the main reasons it's not more widely used today. One of the biggest ones, I think, would be the increased cost. Another one is storage. So, most of the cartridges and such that you have to use in some of the point of care testing need to be refrigerated. You have to teach all of your healthcare providers how to use it. You also have to teach them to understand the results when what they mean when they do get results from point of care testing. It increases the workload for paramedics, so instead of just doing normal patient care, it does add something else to they have to do during transport. And just like anything, again, there's potential for errors from underprepared paramedics. In this slide, we're going to go over a few examples of point of care testing. One of the main ones I would say, especially in the EMS world, is blood glucose testing. That's something that we probably use on almost every patient that is altered. So that's a big one. There's molecular analyzers to detect infectious diseases, blood gas and electrolyte analysis, rapid coagulation testing, rapid cardiac marker diagnostics, pregnancy testing, and even fecal occult blood analysis. So I think rapid cardiac marker diagnostics would be a big one that EMS could use more often because it would definitely solidify a diagnosis. When you see ST elevation, you can then test for rapid cardiac markers that show in the blood that actually are in the process of having a heart attack or an MI. On this slide is just a few pictures of actual point of care testing. So you can see obviously a pregnancy test, urine analysis is happening in the top middle, the blood glucose on the bottom left, which is a big one. And then on the bottom right, which we'll talk about more throughout the presentation, is the iStat, which is probably one of the more updated point of care testings that are slowly getting integrated into the EMS world. And it has the availability to show a lot of testing, do a lot of testing, give a lot of different results, which is pretty cool. The top right, you're going to see it's a fecal occult blood test. So they'll be able to test fecal matter and see if there actually is blood in it. And then in the middle, you are seeing where they're doing either a hematocrit, they're doing a blood gas test there. On this slide, we're going to go over just a little bit about blood glucose testing. I know we all know a lot about that because, like I said before, it's one of the most widely used point of care tests in the pre-hospital setting. This test provides blood glucose levels in patients, usually presenting with altered mental status, to make sure that they are not hypoglycemic. There's two different types used by EMS. One's calibrated to analyze whole blood samples taken directly from a vein, and the other one that's more common, which we see most of the time, is what we've practiced with in our program, is it calibrated for a whole blood sample taken at the capillary level, so like from a finger stick. And this one actually is more accurate and less invasive, obviously, because you're just taking a finger stick instead of actually having to get access to the vein. In the top right, you'll see the picture of an actual setup for a blood glucose test. You see the actual monitor or the reader. You see lancets, and you also see in the top part of that bag the actual test strips that you put the blood on. In the next slide, we're going to go over actually the steps to be able to actually take a blood glucose test from a patient. Like I said before, this slide is going to help us go over step by step how to actually take a blood glucose from a patient. We're also going to provide pictures to the right to show you exactly how to perform those steps. So for the first one, you actually just clean the area with an alcohol wipe. So just select an area. Side of someone's finger is the most widely used time when you're doing an EMS. And then you just clean that area with an alcohol wipe. Step 2, you take a test strip out of your container and make sure you put that into the glucometer so it is ready when you do receive the blood from the patient. Your next step is to stick your patient's finger in the place that you cleaned with alcohol wipe with a lancet device. Your next step would be to first wipe the first drop of blood you see with a 2x2 or a 4x4 gauze. You never use the first appearance of blood on your test strip. You then squeeze the patient's finger again to make more blood appear. You'll then check the meter is ready and transfer that blood onto the test strip and wait a few seconds for your results. And lastly, you read your results. It's probably the easiest part of the test, and that's all. This chart is showing us appropriate blood glucose levels. So this is going to be during fasting. So this isn't going to be after a patient's eaten or how after they've just had a meal, because that's obviously going to show them a higher blood glucose level. So what we're looking for is dangerously high is 315, so that's really bad. But more often than not in the EMS world, we're going to see, when we have an altered patient who is diabetic, we're going to see really low numbers, such as even between 70 and 50. The chart here shows milligrams per deciliter and millimoles per liter. You're most of the time going to be seeing milligrams per deciliters on your glucometer, but that is something very important to make sure that you know which one you're measuring in, because it's going to change obviously your values. Okay, so this is the iStat. This is probably one of the more updated point of care testing available for EMS, and I think it's one of the more exciting ones. It's a handheld portable blood analyzer that is combined with the single use test cartridges that deliver lab quality results in minutes. So they have different types of cartridges that you can load into this iStat, and it'll give you different results. So it's fast. It provides test results in a short amount of time, approximately 2 minutes, to help expedite clinical decision making. It's obviously portable. You see here it's about the size of an old school cell phone. It's easily transported and can be used in all environments. It's accurate. So all these cartridges have certified quality results, which is great. Obviously, you don't want to use something that is just says that it's going to work. You want it to be certified lab quality. And also, it's relatively affordable. So the machine itself is not that expensive. And then the cartridges you do have to buy multiple cartridges because you can only use one per patient. So this picture is actually just showing you the test process, and obviously it's only 4 steps, so it's about as easy as it gets. So the first one is you're going to apply a few drops onto the blood cartridge that you are using. I'll show you pictures of those in the next few slides. Step 2, you're just going to insert the cartridge in the analyzer. The analyzer is going to do all the work for you. Step 3, there's an LED screen that'll show you the results instantly. And then, not instantly, but within about 2 minutes. Step 4, this is more so for there's a wireless iStat that you can use that will transmit results to their records directly from the actual iStat, which is pretty cool. Alright, so in the next few slides, we're just going to go over the different cartridges that are available at iStat and what they actually will give results for. So this first one is the Chem 8 Plus, and the pricing is approximately about $500 to $600 each, so that's per each cartridge. Thankfully, you're not having to use one of these on every patient, but you just know that if you have vitals or something that is pointing towards maybe something you want to know more of, you can use these on a patient. So this one gives results of electrolytes, sodium, potassium chloride, and ionized calcium, CO2, anion gap, glucose, creatine, urea, nitrogen, and the hematocrit and hemoglobin. So as you can see, this one cartridge alone gives a pretty wide range of different test results, which I think is pretty cool. So, like I said, if we're going to be spending that much money per cartridge, we'd like to know the diagnostic value in the pre-hospital setting. So, for us, like as paramedics or EMTs, first responders, the Chem8 Plus provides the most diverse result of all the cartridges provided by the iStat. Like I said, I read you a pretty long list of results it provides, so you can diagnose a variety of complaints in under just 2 minutes with only a few drops of blood. So you could diagnose or get a differential diagnosis for complaints like dehydration, respiratory distress. So the dehydration is with the sodium levels. Respiratory distress, hyperkalemia that can cause heart rhythm disturbances, metabolic acidosis, and other electrolyte disturbances. So here's a chart I thought was pretty interesting. It's comparing the normal values of these things in normal healthy patient blood on the left, and on the right it's showing the reportable ranges of that Chem 8 plus iStat cartridge. Just to go over a few like so for sodium, normal value is about 135 to 145 millimoles a liter, and they can obviously see between 100 and 180 according to this table. And so, just for an example, if you see a patient that may look dehydrated and you don't know exactly how much normal saline you'd like to give them, and then you can check their sodium levels and you can tell by how high their sodium levels are, how much normal saline you actually would want to give them. And then another example, so for the anion gap, you can see normal values is from 3 to 10 millimoles a liter, and the reportable ranges are pretty intense on that side as well. So you can tell if they have bad levels of anion gap, if they're in like metabolic acidosis, respiratory acidosis, such things like that, which I think is pretty cool. This is another cartridge available from iStat. These are pricing approximately $600 each per cartridge. This gives a result of troponin levels. So this is going to provide a really cool diagnostic value for patients with suspected myocardial infarction. So below I put down the normal troponin levels, the reportable range, and then troponin levels indicating MI. So I think a big issue when reporting ST elevation to hospitals, maybe sometimes they don't trust your ability in reading the EKG, or you're not entirely sure that EKG looks like they're having an MI. This test alone will help diagnose an actual MI just by looking at the troponin level. So I think that this one specifically has a lot of diagnostic value for EMS, and especially because, like I said, if you're pretty sure that someone's having an ST elevated MI or something like that, or maybe you think they are having an MI and they're having a silent MI, this will help diagnose it for sure, and you can send that information along to the hospital. This is going to be the last cartridge that we go over for the iStat, the CG4 Plus. So these aren't quite as expensive as the other two, but they are pricing about $300 to $400 each. So again, that's per cartridge. This will give results for lactate levels and blood gases, including pH, PCO2, PO2, HCO3, and SaO2. So I think this is a big one that'll provide a lot of diagnostic value for patients with in respiratory distress or failure, or patients on a ventilator. You can be more specific and see exactly the levels of their blood gases, and then also patients with suspected sepsis. So if you think you're suspecting sepsis in a patient, you're able to just run one of these tests and see what their levels are, their lactate levels are, which again will help determine what your patient route of care is, and also give you the ability to reach out to the hospital and let them know ahead of time, get them prepared. I think this is a big one for patients who are in long transports on critical care vehicles that are on a ventilator. So this gives the paramedic or other healthcare professional on the critical care truck their ability be to watch their level, their blood gas levels a lot more closely instead of having just to hopefully wait and make sure and just check ventilation status and stuff like that. They're able to look way more closely on their status, which is really cool.